Ladies and gentlemen, you are listening to Life Well Lived by Omobola Stephen. It's an engaging and enlightening talk show on life, relationships, and the business of life. Grab a cup of juice and just chill. Life Well Lived by Omobola Stephen. Live life. Live fully.
It's a pleasure to have you, Levesque, who is the naturopathic doctor on the show with me. Now, Dr. Jane, I call her, focus on helping high-achieving women get healthy for fertility. Welcome to the show, Dr. Jane Levesque.
Thank you so much, Omobola, for having me.
It's a pleasure having you on the show today. Now, I'm looking forward to your expertise. On today's show, we'll be talking about naturopathy, getting healthy before pregnancy. And now that's very important, especially for us women. Right. So it is known that women are high users of CAM, which is the initial complementary and alternative medicine, including naturopathy, and that CAM is frequently used by pregnant women. But however, we still know a little about the consumption, practice, and role of naturopathy in pregnancy, labor, and postnatal care. So, doctor, what do you think we're missing here?
So sorry, Omobola, can you repeat the last question?
All right. The question is, we all know that women are high users of CAM, right?
Yep.
The initial, right, for complementary and alternative medicine, including naturopathy, and that CAM is frequently used by pregnant women. So, but however, we still know a little about the consumption, about the practice and role of naturopathy in pregnancy, labor, and in postnatal care. So I would like to ask this question. Is there anything we're missing here?
Yeah, so when it comes to naturopathic versus kind of conventional medicine, if you will, the big difference, so just like you said in your message, is the goal is to get the woman, and really it's the couple, as healthy as possible before conception, because your fertility is going to be a reflection of your health. And so if you have health issues before you're starting to get pregnant, and that could be your menstrual cycle, it could be weight issues, it could be fatigue, anything that's basically just going to be really exaggerated once you get pregnant. And the goal with the naturopathic medicine is really to look as a woman and as a couple as a whole, because again, sperm is 50% of the DNA, and egg, the quality of the egg is 50% of the DNA, and to help the couple get as healthy as possible before they go in, versus, before they go in to decide to start trying. Versus on the conventional side, we really are just looking into patching up the problem once it happens. So you're not preventing anything. You're just go ahead and start trying. And then once you start trying, then you see, then you try to patch up the problem, if you will. So having to use medical interventions, medications, to balance hormones, to get the woman to ovulate, maybe to fix sperm quality or something like IVF, a more invasive procedure where you actually are doing an implantation.
Right. So in a situation that we have here in our society, where older women are more likely to have conditions like high blood pressure, diabetes, and also other cardiovascular diseases that can complicate pregnancy. So how does how does it affect pregnancy?
Yeah, I mean, it could actually, and this is going to depend on each woman, but if a woman has diabetes or coronary artery disease or anything, that is a sign that there is an imbalance, right? There's a blood sugar dysregulation. The liver is potentially not working well. If there's triglyceride, there's blood flow that's low. And so that's just going to impact the quality of the egg. Because again, when you have to be medicated for those things, then you're going to, the health and vitality of you as a person is much lower. And so when you're pregnant, it's the hardest thing that the female body will ever do. And so I always talk about it like preparing to run for a marathon. Yeah, you could run a marathon without doing any kind of training, but you're likely to get hurt and maybe you won't even finish the marathon in the first place. And, that's more talking about pregnancy loss. And so this is the same thing when we're talking about having diabetes or coronary artery disease or any other kind of issues, is that you're not as prepared as you could be, so that your body is not as resilient, it's not as strong. And so to go through a marathon when you're not prepared, you can imagine that that's going to be really hard on your system. So you might be predisposed to complications during pregnancy. You might actually not be able to get pregnant or carry to term, or you might have a difficult postpartum depression. Thyroid issues come up a lot during postpartum. And then, of course, the health of your baby. So the health of your baby is going to be dictated by your health. You can only pass on what you have. So if you don't have a lot of vibrance and energy and resiliency, you can't pass that on to the next generation. And that's actually why we're seeing so many kids that are now sick chronically, because the parents are not as healthy. We're not as healthy as a society as we used to be even 50 years ago. And we're starting to see that patients are on average 20, 30, 50 pounds heavier than what they were 50 years ago. And it's not about the vanity of it even, but just like carrying extra weight is inflammation. It's diabetes. There's, hormone imbalances that come with that. And so we're starting to see that in younger and younger populations. And it's just because we're passing it on. We're passing it on to our kids. And so that's my message is let's get healthy. Let's figure out our own health so you don't have to pass it on to the next generation.
Now, I know that we've got a lot of work to do in that regard.
Yes.
So away from that, we talk about the older women. How about the teenage mothers to be, right, who are more likely to experience pregnancy-induced hypertension, right? I begin to wonder why hypertension, right, in this situation. So is there a particular age range where it's really okay for a lady or a woman to decide they want to get pregnant?
Yeah, for sure. And so the issues that you're going to have as a teenager versus when you're older to get experiencing a pregnancy are different, because as a teenager, your physical body is actually fairly strong and resilient, right? Like that's generally when you are healthiest, you have a lot of vibrance, you have a lot of energy. So from the physiological standpoint, your body has a lot to give. But from the development stage of your brain and the, emotional stability, the financial stability, you're not very developed at all, right? The frontal cortex of the brain is not fully developed until you're 21. So your ability to make good decisions, your ability to be able to provide for the baby, to be able to actually support yourself through the pregnancy and all that is much lower. So physiologically, you might have a quote unquote healthy pregnancy because you have a lot of vibrance and a lot of energy when you're young. But because you're so underdeveloped, if you will, like your brain is not fully developed and you don't have a financial, and then it depends on, are your parents supportive, or are you kicked out on the streets because it's taboo to get pregnant as a teenager? So the problems are going to be different. And that's why there is usually that sweet spot of you still want to have that young, vibrant energy, but you want to have some stability in your life as well. Like you want to make sure you're with a partner that you actually want to be with for the rest of your life. You have a career, or at least you have some sort of financial cushion that because that's going to be obviously stressful. Kids are expensive. And there is a sweet spot, but it's going to be different for everyone. What I find in a North American culture, especially, is that couples are just waiting too long now. They want to make sure that they have their career not just set, but they want to be at the peak of their career. They want to not just have a house, but they want to have a really nice house. And so what that does is prolong it. And it actually makes it to the point where, I don't want to say you're too old, but at the age of 35, females' fertility decreases drastically. It starts to every year. And that's a lot of women will come to me and they'll say, I'll feel like my clock is ticking, and they're 35. And I'm like, yeah, your clock is ticking. I'm not going to lie to you. But it doesn't mean that it's impossible to get pregnant naturally, right? There's chronological versus biological age. Like, how well do you take care of your tissue? Because if you eat well, you exercise and you sleep and you manage your stress, your tissue in generally is going to be much younger than what your age is. And that's true vice versa. If you eat junk food, if you don't sleep, if you don't, exercise and you don't sweat enough, your tissue is generally going to be older. And that's going to reflect on the quality of your eggs and your sperm, because that's your cells are your cells, right? It's the egg and the sperm are just cells that are in your body. So with obviously very special function. So there is a sweet spot. And I would say it's anywhere between that 25 to 30 mark. And most people don't start thinking, in the North American culture, at least, don't start thinking about having kids at least until 30. And so that's where then it becomes a little bit more rushed, and you have to really look at the person's health. So I'm not sure if that answers all of your questions. I know that I can ramble, but teenagers usually physiologically can handle it, psychologically not. And vice versa on the other side, where we're too ready, we're too not even too ready, but we have far more than we think we need to start having a family.
So invariably, doctor, what you're insinuating is that we can really get to the point where we can say, this is the exact age you need to get pregnant, because we also need to consider all the variables and factors, right?
Yes.
And individual choices also matter here.
Yeah, for sure. And there isn't a perfect age. Like I'm always going to give you a range, because each person is going to be different, because it depends on where they are in their life, right? Like, how stable do you feel? Because if you're 25, but you've been on birth control and you have antidepressants and you're taking, that's not the best time. Will it be better for you to take 2 years to get healthy, get yourself off medication, and improve the quality of your egg, and improve the quality even of, like, if you're on antidepressants, there's obviously mental, emotional components that need to come into place. Then for sure, it's going to be way better, worth your time. You're going to feel much better through the pregnancy, postpartum. You're going to feel like you're a better parent too, because you have more confidence and control of your own health. You can pass those habits on to your kids, and you can connect with your children in a much different way than when you're exhausted, tired, depleted, all of that kind of stuff. So it's really doing a bit more of a unique assessment for yourself and doing those checkpoints.
Right. Now, you were emphasizing on what we feeding in, right? And that's very important. And nutrition, generally, it's important for our general well-being. So as a naturopath, what are some pregnancy-specific nutrients a pregnant woman can focus on?
Absolutely. And so I'll kind of start with some of the mistakes that women will make. And the mistakes that women will make is they'll diet right before going into pregnancy, because they're so worried about gaining weight that they want to make sure that they're at their skinniest. And they'll do things like intermittent fasting, ketogenic diets, and they'll just kind of juice cleanses. They'll just jump on trends that are in the health and fitness industry. So health and fitness industry is different from, so trying to get lean and trying to put on muscle and be skinny or whatever is very different from learning how to nourish your body so it can start to grow a human. So you're growing a human from scratch. You don't want to diet before you do that, because you're depleting yourself when you're dieting. You're not consuming enough calories. You're not consuming enough nutrients. And dieting is very stressful on the body. So it puts your body in a state of stress. So what you do want to do is the opposite of that. And you want to nourish yourself with whole foods. Whole foods is always the thing that, like, did it come from the earth? Can you grow it? Can you kill it? Can you pick it? Right? As opposed to packaged foods, as opposed to like alcohol and, any drug use obviously is going to be off the smoking, that kind of stuff is going to be off limits, but just eating high quality fats, meat and high quality proteins. So meats like grass-fed beef or lamb, anything that's going to be fatty, because that's what we need for hormone, but it also has a lot of fat soluble vitamins, which are very important for brain development. And then you need lots of leafy greens and just eating the rainbow. And again, it's whole foods. So when you're eating the rainbow, you're eating all different types of nutrients. So we all talk about folic acid or folate and how important it is for the development of the nervous system and just the replication that goes on. But that's just one nutrient. And you never just need one nutrient. Our system doesn't work like that, so there's synergy within vitamins and minerals and different macronutrients like proteins and carbs. And so when you have this whole food diet of having high quality protein, high quality fat, and lots of fruits and veggies, and of course you can have some grains, then you kind of are hitting all of these areas. And usually when you eat those foods, you feel nourished. Like when you eat a home cooked meal that has a bunch of veggies and right, like at the end of that meal, I feel super nourished, as opposed to if I go out and eat, even if the restaurant is quote unquote nice, you still feel there's not enough veggies ever. There's not enough protein, usually way too much fat, too many carbs. You feel heavier, you feel sluggish, that kind of stuff. So if I can get people to eat whole foods, if I can get you to start cooking for yourself, I think that's a big component that we're starting to miss in our society. We're so on the go. We just want someone else to do it. But nourishing yourself is actually the first step to learning how to self-care for yourself. And then that's going to transfer really well into postpartum and caring for your baby.
Right. Thank you once again, Dr. Jane, for your insight on today's show. Doctor, naturopathic doctors, right? They promise more natural in court, right? Care more than the medical doctors. So, however, critics also say that their treatments are often unproven. So, you've been in this profession for over 6 years. What's your take on this?
So what do you mean by like unproven? Is that there isn't enough research or there isn't enough studies to show that it works?
That's right.
Yeah. So, I mean, at that point, I think it just depends on what you're researching, because the research and the studies that I look at, right, all show that it does work. And then it's not just about the research that you see on paper, it's also your clinical experience. And in the naturopathic world, I mean, in any alternative medicine, through my own personal journey, what I started doing is following people that I want to be like. So when I go to my doctor and my doctor is overweight, pale, sickly looking, I don't really want to listen to that advice because I don't want to look like that. And when I go to an alternative healthcare provider and their skin is glowing, you can tell that they exercise, they have good muscle tone, they're attentive, they make you feel heard, then to me, that's where the alternative medicine really wins, if you will, where we're developing a relationship. And so then using natural herbs and supplementation, well, there's a ton of studies on that show how they work. And if for example, they'll say, oh, okay, well, vitamin C doesn't work to support immune system. You have to look at who wrote the study, what kind of vitamin C did they use, what was the dose that they used, what was the circumstance, because a lot of the times it's the dose wasn't correct. It was really poorly absorbed vitamin C. It wasn't used for a long period of time. And then compare it to studies that do. So it really depends on who's funding it, because it's funded by the big pharma. You're going to show that, hey, natural stuff doesn't work, because guess what? They get paid when somebody's on medication. And yeah, you could say it's the reverse on the other side for, supplements and alternative medicine. But I think deep down, we all know, and don't get me wrong, there's times where we absolutely need medication, but medication is designed to be used for a short period of time. And that just hasn't been the case. We've been put on medication, and I have women who've been on birth control for 15 years and they're not even 30 yet. That's a huge problem, right? And that's the same with antidepressants. I had a patient who has been on antidepressants since she was 16. So it's been a decade, and it's like, you're a different person now, and of course that the studies will show, no, you're totally fine and you can keep taking it. But I think deep down, we all know that our body has an incredible capacity to heal, and that there's more to life than just being on medication and moving through life. And so if you can listen to that intuition, because that's your power, that's your soul speaking to you, if you will, you just have to find the right practitioner to help you get through. But, with studies, it's like, who's writing them? That's really my question.
Good to know, doctor. Can a pregnant woman employ both the services of a medical doctor and also a naturopath?
Absolutely. And she should, I would say. I think it's best to have a good team. And, again, I'm never against conventional medicine system, or I think comes down to like every doctor is going to be different, whether it's alternative or conventional. And when you're pregnant, the more support you can get, the better, because there's so many things that can go wrong. And I think the biggest thing is that women feel unsupported through that period. And now in the society, it feels like there's a shift. So women are getting more, like they'll have midwives and they have an OBGYN and they'll have a doula, and because they're understanding the importance of the support throughout the pregnancy. But now I think the postpartum period is still lacking. I think women will get support for the first 2 weeks, maybe the first month, maybe 3 months, but the truth is, like, you have babies, it's so much work, right? And the first 3 months is just like the tiny fraction of beginning of what's to come. And so I think if we can develop a program that's a bit better for postpartum and become aware in that area, but the more support that you can have, the better, because it's just such a big transition. It's a big transition, especially for first-time moms, right? The first time you go through that experience of a pregnancy and labor and having a baby handed to you at the hospital or at home, wherever.
Right. So I want us to quickly look at the challenges of naturopath, because we know that in life that's always good side and not so good. So what are some of the current challenges and the future directions of naturopathic medicine?
I mean, I think the biggest challenge is always being bumped against the conventional medical system, and whether it's putting out, I don't want to say false studies, but, just not supporting us, because I think most naturopaths that you talk to would never say that they hate conventional medicine and there's no place for it and it's voodoo and whatever. We all very much understand why we need it, but we also understand the limitations. And so the biggest challenge we have as naturopaths is sometimes people won't take us seriously because we've been so, pushed aside by the conventional medical system, and it doesn't work. And sometimes there's, maybe it's naturopaths, or maybe it's an alternative healthcare provider that didn't do their due diligence and didn't send their patient to their conventional medical doctor when they really should have. When somebody needs antibiotics, they need antibiotics because there's an infection going on. And we need to understand and respect the power of the natural medicine, but also the reason that we have the conventional medicine in place as well. So it's really just making sure that our voice is heard, but it's heard in a way, it's like putting your best foot forward as a naturopathic community, as an alternative community, and making sure that we do our due diligence, because you're going to have bad experiences. You're going to have a bad experience at a doctor, and you might have a bad experience at the naturopath, or, whatever other alternative healthcare provider, but that doesn't mean you can write all of them off. And that's kind of what I'll face. I'll have patients say, oh, like my naturopathic medicine didn't work and it's like, yeah, but sometimes you go to a gym and you have a bad personal trainer. Will you say that you never need to exercise again? Probably not. So that's the same thing. You just need to know that, hey, we're not all the same, and you just need to keep looking and know that there are a ton of really good ones. And if you had a bad experience, that was just a bad experience, and you can move on from that.
Right. Dr. Jane, do you have any parting words you'd like to share with the audience?
If I can get women and couples to just think about pregnancy in a different way, and what I mean by that is, like, it's such a big event in the woman's life, because it is the hardest thing that the female body will ever do. It is the biggest change that you as a couple will go through. And it is the most permanent change that you will ever experience, more permanent than getting married and then buying a house. And so if I can get you to think about it a little bit more from investing into yourself and into your health, as opposed to preparing your home and your career, which, don't get me wrong, are important, but a lot of the times we overdo that and we don't take care of ourselves. So if I can get couples to prepare themselves for pregnancy, get themselves in the best spot possible, then, I'll feel, I know that your experience is going to be much different, and you're going to prevent a lot of heartache, whether it's through your fertility journey, through pregnancy, or postpartum.
Right. Any projects in the pipeline you like to share?
Any projects? I mean, so the biggest thing right now is I have a fertility group. It's a free Facebook Dr. Jane's Natural Support Fertility Group. That's where I post a lot of my free information. I connect with my community there. I'm also on Instagram as well to share the content. And I have a Fertility 101 program that I run. And that's a program for anyone who's looking to get pregnant in the next kind of 3 to 12 months. And they really want to know, how can they prepare themselves? What foods should I eat? What supplements should I take? What labs should I run? How to create a perfect environment for yourself and your future baby. That's the program that I recommend. And then, of course, if you are needing more help, then I take some patients one-on-one.
Right. You like to have your social media handles on your website?
Yes. Yeah. Do you want me to say it? Yeah, it's just www.drjanelevesque.com. And so my Instagram and my Facebook is all Dr. Jane Levesque. That's where you can find me. Right.
Good to know. Thank you once again, Dr. Jane Levesque, for your incredible insight on today's show, talking about naturopathy and health and wellness, especially for women, high-achieving women who are seeking to get pregnant.
Yes, thank you so much, Omobola.
It's been a great pleasure having you on the show. I can only wish you the best of luck once again in your future endeavors.
Thank you.
All right, good to know. So, like you like to catch up with these episodes of Live Well Lived by Omobola Stephen, you can catch up online. Just type Live Well Lived by Omobola Stephen on any podcast distribution platforms you bump into, and you have an amazing time. Perhaps you'd like to be a guest on the show, like to share disruptive mindset content with my audience. You can mail me at omobolastephen.o@outlook.com. Now, I'll be looking forward to your mail. So, like, call me over, I need it to be good. Bye for now.